Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness. Welcome to another episode of Birds.Bees.Bodies, Season 2, brought to you by Planned Parenthood of Southeast and North Florida. I'm Michelle Quesada, the Vice President of Communications for the organization, and we are really excited to talk about a very important, vital, critical topic in this episode today, abortion access and what's at stake in Florida. We have expert guests on the podcast. Our Vice President of Public Policy, Laura Goodhue, is on, and one of our staff physicians, rock star physicians, I should say, Dr. Chelsea Daniels. And so, I want to jump right in. Welcome both of you. You both have been on the podcast before with extensive expertise in your fields. But what's happening in Florida is really like we're at a critical, pivotal point in our state right now with abortion access. I think yesterday I was writing a memo about, the height of reproductive health care. And I was talking about 1973 with Roe v. Wade. And then I'm looking at where we are today. And it's probably one of the lowest points that our state has ever been at with reproductive health care. So let's talk about this near total abortion ban that is in effect right now in Florida. Went into effect May 1st. This is an extreme ban that makes it illegal for anyone to access abortion care when they are beyond 6 weeks of pregnancy. And let's talk about that for a second, because 6 weeks does not mean that you've known you've been pregnant for 6 weeks or that you've had 6 weeks to make a decision. What does 6 weeks actually mean? Dr. Daniels, if you want to kick us off.
Yeah, absolutely. Thank you for having me. And also, that was the first time that I've seen the little intro, and I love that my cat made it in.
Yes, I was how to take care of your kitty from last season.
Yeah, I remember. He's unfortunately sleeping, I think, so he won't be making a cameo this time. But what does 6 weeks mean? 6 weeks means the way that we measure pregnancy is from the first day of your last period. So what that means is that if you have missed a period and that's when you figure out you're pregnant, you are technically already 4 weeks pregnant on the day that you've missed your period, which means that by Florida law, from that moment on, you're already 4 weeks pregnant. You have 2 weeks in order to legally obtain an abortion in Florida. And when I think about how long it takes me to kind of get in to see a doctor if I need one, or how long it takes me to figure out if I've missed a period, and 2 weeks is just not a whole heck of a lot of time, especially if you have a busy life and a busy schedule, as we all do. So I think this is a near total ban when it actually comes down to how people are able to access healthcare.
And people are not monitoring their periods so closely.
No.
Not every person who gets a period has a perfect 28-day cycle that in 4 weeks they're expecting their period every 28 days. It doesn't happen.
That's the other thing. Yeah, it's like a lot of people have periods every 35 days, in which case when you've missed a period, you're already 5 weeks pregnant. And I have these really challenging conversations with patients every day because they'll look me right in the eye and be like, Dr. Daniels, I've had sex one time in the last 6 months. There's no way I'm 6 weeks and 2 days pregnant because I only had sex 3 weeks ago. And I feel their pain and their confusion so acutely, because it is confusing and it is absolutely terrifying that the state has put these people in and put all of us into this just like vice grip, and it's just so inhumane.
And I want to get to what the impact has been, but on top of the fact that there's a near total abortion ban, there are other barriers and obstacles in place. Laura, if you can and share a little bit about the other barriers in place when it comes to the forced delay period, when it comes to the non-existent exceptions that we keep hearing about. Talk about those barriers.
Yeah, so the way that this law is written, it's actually one of the most extreme bans in the country. So other states, will have a near total abortion ban, but what makes it very hard for Floridians is that there's a required 24-hour so-called waiting period. Which means that if you come in and you find out that you're pregnant via the ultrasound, which sometimes we can't even see the pregnancy on the ultrasound at 6.0 weeks, you're too late. You cannot wait 24 hours because you have now gone over the limit and you have to try and seek, care elsewhere, which is also not easy. The closest state is North Carolina, and they have a forced waiting period of 3 days. And that's why it's one of the strictest. The other problem is, in all of its wisdom, the politicians in Tallahassee try to carve out these exceptions for people who are survivors of rape, incest. If the fetus isn't viable, if the pregnancy is just not, the baby's not going to make it, or if there's a health exception for the pregnant person. And these exceptions are so narrow because the laws weren't written by doctors. They were written by, for the most part, male politicians that don't understand pregnancy. And so, a rape exception, for example, you have to have documentation that you were raped. So first of all, people that are survivors of rape, the last thing on their mind, is, am I pregnant? They're dealing with trauma already. They certainly may not be thinking about it. And then they have to get documentation. We know the majority of rape survivors don't report. And honestly, and Dr. Daniels can tell you more about this, what we have now found in our health centers is that the police departments are not giving us these reports. They're not giving us the investigations, not us, but not to the patient, because they're saying, well, it's under investigation. So, this old thing that, not old, but this stays, with survivors in this stigmatization of rape culture is that people don't believe them, right? And that's just perpetuating this horrible situation where we now have a number of rape survivors that have come to us seeking care so that they don't have to carry their rapist pregnancy, and we've had to send them out of state.
It's extremely tragic. And Dr. Daniels, you've had a case recently of a rape survivor who came forward, who even we tried to advocate, the health center staff tried to advocate for this person and didn't end up anywhere.
Yeah, it was devastating. It was like one of my worst days at work in the last couple months because it just upset all of us. She came in and she was about 8 weeks pregnant, and she had just recently immigrated to the country, didn't speak any English. Divulged to one of the medical assistants, she was beyond 6 weeks, divulged to one of the medical assistants that she was raped and told her the whole story. And she also said that she had tried to report the rape, but the police department had essentially turned her away. And it was kind of unclear why, but it sounds like the language barrier didn't help things. And the other challenging part was that the county where the rape took place was different than the county that she lived in and where she was trying to report the rape. So by the time she came to us, she was 8 weeks pregnant. And with this so-called exception in the statute, she has until 15 weeks. So I thought, okay, well, we can expedite this for her. Hopefully we'll call the police department ourselves. So we called and tried to file a report on her behalf. And we were told that because she was not a minor or an elder and she didn't have any kind of developmental or physical barriers from preventing her as an adult to make the report herself, we were not allowed to report on her behalf. So we had to send this patient away. We gave her all of the resources to the police department in the county where the crime had been committed, and told her essentially, like, you have 7 weeks to get this paperwork here in Florida. But it is not easy to get this exact documentation that's required by the state. And for something so horrible to have happened to someone and they have survived it and then they've gotten pregnant, and now they're being asked to jump through all of these additional hurdles and interface with law enforcement for just a basic 3-minute medical procedure is, it was a horrible, horrible day for all of us. And I can't even imagine if this is how we all felt leaving the day, how that patient felt going home that day.
as to why the exception is not a real exception. How can you say something is an exception if you're putting in conditions for the person to be able to meet that exception? So they have to be able to get documentation, which we know every 2 out of 3 cases goes unreported of rape. So this is just extremely challenging. And I can tell you from experience, I recently spoke to a police detective who also asked me what kind of documentation was needed because they had one of our patients at their police station who was trying to file a report because they were raped and they needed abortion care and they were beyond the 6 weeks cutoff point. And even the detective, told me flat out, this takes weeks or months to investigate. I don't know what I can get to you right away. And so that is another issue. Like, is it really an exception when you can't obtain the documentation if it's not attainable? And we see cases like this. Other physicians out there will say it's rare because it's not coming across their clinics. It's not coming across their health centers. We're seeing a lot of patients that even Dr. Daniels, you've seen private OBs refer to us because they don't know what to do with this law. And for cases of health complications in pregnancies and even in desired pregnancies where we're seeing patients somewhere along the line, their pregnancy becomes non-viable. It's a failed pregnancy and they're coming to us.
And that's what you see is like, again, I'm sorry, but like the politicians that wrote the statute, and there's no regulations around this, right? And so like we're healthcare providers. And so we end up being case managers. And I can guarantee that like people that go to other doctors, they don't have to face these hurdles. So even with the health conditions, it's very confusing. And we have heard from, hospitals and doctors who are like, I am waiting for the legal department at the hospital to tell me whether or not this poor woman and her husband, who, it's not a viable pregnancy at 14 weeks, but we're telling her that there's nothing that we can do. And she's down here in pain, but the state agency that does, that they are not responding and even defining, what is this arbitrary number of 6 weeks, they're hesitant to even put that in writing. So it's left up to us to figure that out. They're not defining, what is a fetal abnormality, because, we've heard from women like Deborah Dorbert, whose son survived 94 minutes outside of her womb and died in her arms, which she always knew was going to happen, but she couldn't get an abortion.
We're seeing more and more patients who are pregnant who, end up having a non-viable pregnancy are coming to us and are being given, frankly, the runaround by physicians, in other clinics because they're afraid to touch, there's a chilling effect that this law has created. They're hesitant to touch the case and move forward. And part of that, I had a really interesting conversation with one of our other physicians yesterday about some of the reasonings she's hearing from colleagues in the industry and from other professionals, medical professionals, about the billing code at hospitals for someone who has a non-viable pregnancy. And for everyone listening, at this point, non-viable means there's no cardiac activity. The pregnancy is not going to make it. It's a failed pregnancy. And so these patients who are 8, 15, 17, even a 22-week patient who had a non-viable pregnancy, they're going to the hospital. They won't perform the procedure to help them with the miscarriage management at this point, because that's what it is. It's a non-viable pregnancy because the miscarriage management protocol is abortion. It's very similar to abortion and it's coded the same way. And so are you seeing that as well, Dr. Daniels, that you're getting patients who, told you, I went to the hospital or I went to the doctor and, I don't know what to do because I can't walk around with this non-viable pregnancy in my uterus any longer?
Oh yes, I've seen this countless times, and it's getting worse. I was chatting about this patient with Michelle yesterday. That I had a patient, probably about 3 weeks ago or so, who came to me with 4 different ultrasounds from 4 different doctors, showing that this was a non-viable pregnancy, and none of them would help her. And I don't believe that that's because they didn't clinically know what to do or because they didn't know what was best for the patient, but because they were afraid to help her because of, like Michelle said, the chilling effect of this law. This law has criminal penalty for doctors. And because this law is written with murky, vague language, it makes doctors afraid. And I understand that. You don't want to misstep and put yourself or your clinic in jeopardy. And it's it's such an honor and such a privilege to be the doctor who sees all 4 ultrasounds and it's like, okay, what are we waiting for? But it's also, it shouldn't be happening. Like, you shouldn't have to see 5 doctors for a 3-minute medical procedure or to be handed a prescription for a pill. It's just so, it's insulting to that patient. I can't think of anything so immoral in medicine.
And it's traumatic. It's traumatic.
Yeah,
this went through 2 miscarriages, like in a desired pregnancy. That is traumatic to have to prolong that experience, knowing that that pregnancy is not going to result in a child, in an infant that you're hoping to carry in 9 months, and to know that you're walking around with that and no one will help you move on and heal from that.
Yeah,
that's traumatic.
That's the other thing, is she and her husband, this was a desired pregnancy, and they had been told a month prior and 4 ultrasounds prior that this was a non-viable pregnancy. And by the time she had come to me, she wasn't sick, thank God, but you just think about, we've heard cases of patients who this happens to, where they go from doctor to doctor to doctor until they get critically ill.
And what are the health risks? Like, you can get infection, you can go into sepsis. I mean,
you can hemorrhage. Endless health risks. And I just am so grateful that we were able to act before any of that happened, and she's healthy and, no adverse effects to her. But you just think about what would have happened if she had continued going around with these ultrasounds, begging for someone to help her, and no one had.
It's just the mental trauma that family had to go through that they didn't have to go through before May of this year, when that law went into effect. I mean, I know many people like me out there have had ultrasounds when they're pregnant. It could be a really happy experience. This woman had to go through 4 of those. Mm-hmm. I mean, it's an invasive, I'll say invasive procedure, it's still a procedure. You have to go into that's horrific. The mental trauma that is being imposed on these women, completely unnecessarily, completely arbitrarily. And then these poor doctors who, somebody always wants to look and blame, oh, why didn't they? They don't want to do this either. Yeah. They are literally facing losing their license and going to jail, because there are there's felon penalties if they do the wrong thing. And that is not what healthcare should look like in this state. That's not what reproductive freedom should look like in the state. And none of us should be going through this.
And it just proves how abortion bans really harm anyone who can become pregnant, whether you were intending to become pregnant or you did so unintentionally. Like, it can harm you either way. I do want to chat for a second about, the number of patients that come to us that are not able to get care. We have patients that come to us at 5 weeks, 6 days, and are forced within 24 hours to make a decision to make it to 6 weeks. This is also adding pressure on people in Florida to make a decision quickly if they're able to get, into care early enough before the 6-week cutoff point. I mean, we had, I can just give an example of a patient we had a few months ago who had a job where she could not miss work. If she missed work, she would lose her job. And so she didn't make it to our health center until 6:30 p.m. because that day we had an 11 a.m. to 7 p.m. clinic day. Made it at 6:30, found out she was 5 weeks, 6 days pregnant. So she did her first day consent, because remember, Florida, we have that forced delay period. You do a consent visit to get all your information about the abortion procedure. And then you have to come back 24 hours later to actually have the procedure, even if you've already made up your mind that this is something you want to do. And guess what? 24 hours later is 6:30 p.m. the next day. No abortion clinic is open the next day at that time. So we had staff, Dr. Daniels, one of them, who rearranged their lives and their schedules to stay late to be able to help this patient. And this is another situation where it just, patients are having to go through all this stress to be able to get this care, even to meet that arbitrary 6-week cutoff point. And are you seeing a lot of that? Like, patients are coming in right at the cusp of time, because abortions are still happening. And I get questions from reporters all the time. Well, you're still seeing abortions happen. According to the state numbers, we're seeing that they're happening. Yeah, but there's a 30% decrease across the state as well, according to the latest Bootmacher data release. 30% decrease. What's happening to these patients? Because we know they didn't disappear. They're either being forced to carry the pregnancies or find alternate ways to find abortion care in another state.
Yeah, I mean, this is the patient that you're mentioning, she's not the only patient who we've all stayed late for. This has happened numerous times because, like you mentioned, we have one day of the week where we're open really late. And if you are the last patient of that day and you're exactly at 5 weeks, 6 days, then that means that 24 hours later, we got to stay open for you. When we're rearranging staff schedules to be open for half days on holidays to make sure that we can increase access, because, I mean, like you said, this is a life-changing moment, right? All of these people who have just the unlucky 6:30 p.m. appointment time instead of the 2:30 p.m. appointment time, that 4 hours can change the outcome of their life. And it just is, that's a pretty humbling thought.
Yeah, and they have to do it because they're working, right? So
Right.
this woman came straight from work to the clinic, found out she's pregnant, didn't want to be pregnant or didn't intend to be pregnant, and now has 24 hours to figure out her life.
Yeah, absolutely.
I think, like, maybe our listeners know, just like giving healthcare, receiving healthcare, it's a full-time job often, right? Like, especially if you're managing it for your family. I know I'm managing it right now from my husband, my kids, even my parents. A lot of us are in that sandwich generation, and we're keeping track of appointments. We're trying to get, go into the labs. This is, it's already complicated enough, right? And so, like, Planned Parenthood is there for our patients. We're trying to provide as much wraparound services as possible, but we know, like, that in this busy world, other providers are not even able to do that, right? They're not able to stay late. They're not able to try and get documentation from the local police department. And I think it's just so unfair that these women and these pregnant people have to go through all of this, because it's also, like, very time sensitive. Some conditions are and some aren't, but obviously you cannot wait months and years for an investigation into whether or not a person was sexually assaulted. You just do not have that time, because the outcome is, you're delaying care and has such real impacts. Like, you can't go back from that.
I feel like the irony of what you just said, Laura, too, is that there are situations in medicine that are critically time sensitive, right? Where someone can be literally dying in front of you and they need life-saving intervention. In a hospital setting or whatever, an emergency room setting. And in this situation, we have people who are coming in, and the law is the one telling us that now these are arbitrary time restrictions that we're putting on all of you, and we're going to make you involve the police, and we're going to make you involve a judge, and we're going to make you involve a legal team and a doctor. Oh, and by the way, you have to do this all within this arbitrary time limit we've set. And it just is like, as a physician, I think about actually medically time sensitive situations. And it's yeah.
Yeah, I urge our listeners to like just put this into perspective, that this was your wife, your spouse, or your sister, your mother, your cousin, your best friend, whomever that person is for you in your life, and they were pregnant, and they have an emergency. Do you want to go to a hospital and hear the doctor tell you, I have to consult with my ethical board or with my attorneys, the attorneys of the board, to figure out if I'm able to help you or not because of this law? Like, that's not what you want to hear. You took an oath to take care of me, to handle my emergency. That's what you're asking for. I mean, in full transparency, I'm 33 weeks pregnant, and in a very much wanted pregnancy. We always wanted to have a second child and grow our family. And this is something that scares even me, because if I ever need care, can a doctor, intervene to help me and save me? I have another son to think about, a 2-year-old. So these are things that women should be able to make these decisions for themselves on how they want their care handled in an emergency scenario. I want to go back for a second and talk about something Laura mentioned, back to the documentation and the weeks and months that this could take to close an investigation. I heard a very disturbing comment the other day from a reporter who said they had interviewed another doctor that's, an OBGYN, who said, oh, people are not leaving the state for abortion care. Yes, they are. And even rape survivors are leaving the state. We're currently helping navigate a rape survivor who would not get the documentation they needed from, like, the police department would not provide them the documentation they needed, and they're 8 weeks pregnant, and they're going to be navigated to another state to get care, adding to their trauma. We have navigated, our patient navigation team has navigated more than 600 patients of ours, just Planned Parenthood of Southeast and North Florida, since May 1st to other states to get care because they were beyond 6 weeks. That's just us. Planned Parenthood has another affiliate on the West Coast, and there's also independent abortion clinics across the state. Planned Parenthood makes up 1/3 of abortion providers in Florida. So you're talking about thousands of women at this point who most likely have been navigated to another state since May 1st. And think about that. If you went to the doctor for any procedure and they told you, oh yeah, you need this procedure, or we can do it, but the state won't allow us at this point, so you need to pack your things, make an appointment, and travel across several states to get this care. And that's what we're expecting our patients in Florida to do, to take off work, put their child, in someone else's care for them to be able to leave the state and get this care, come up with the funds, right? Because there's financial assistance out there, but it may not cover everything, to be able to go and get this basic healthcare in another state. And it's just awful. I mean, I'm sure, Chelsea, your patients are like, wait, you're asking me to do what?
Yeah. And I think that also just goes to show how arbitrary it is, right? Like you can, prior to moving to Florida, I lived and worked in North Carolina, and I'm often referring patients to my friends and my colleagues who will text me and be like, I'm seeing a patient of yours. I see your name on the ultrasound. And it's like, it makes no sense. Or even more kind of like the craziness of it all is I travel and do travel work for abortion care up in Virginia and Maryland. And I'm seeing a lot of Floridians, particularly in Virginia. And I'll oftentimes be sitting with a patient and she'll mention to me that she's from Fort Lauderdale and I live in Miami. And I'm like, wow, we have both traveled over 800 miles. When we live down the road from each other, we've both traveled over 800 miles to both give and receive this care. It makes no sense.
None. So we've talked a lot about the impact. We've talked about what's at stake, and there is action being taken. I do want to touch on Amendment 4 and just briefly educate our listeners on what Amendment 4 is and what does it do. Laura, if you can share with us, what exactly is Amendment 4 and how can people learn more about it?
Yeah, so this election cycle, there will be a question on your ballot to vote whether or not to reverse this horrific ban. The only way we can reverse everything that we're talking about today and get rid of this law and to stop, politicians from interfering in our healthcare and put abortions about our reproductive lives back into the hands of pregnant people and doctors is to vote yes on Amendment 4. So Florida has a process where citizens can sign petitions and get a question in front of the voters to amend our state constitution. And so that's what we're doing. We have that has already been approved. It's going to be on the ballot. It's Amendment 4. And so a vote on Amendment 4 means reversing this extreme abortion ban and getting politicians out of our healthcare decisions.
And you can learn more about it by going to FloridiansProtectingFreedom.com. That's the coalition that has been behind Amendment 4, that's been advocating for Amendment 4. And really, it's just a matter of getting educated. If this may not directly impact you right now, but we've talked to so many young women and young people who want to start a family someday, and this can impact you. This can impact our healthcare. How many doctors do you think are really going to stay in our state, skilled providers that are going to stay in our state if they can't offer this care beyond 6 weeks, and they're going to lose their, their skills and their training and everything that they've worked hard to? And do you want to go to the hospital in whatever time from now and find out that the doctor who's caring for you has never been able to do this procedure beyond 6 weeks and doesn't know how in case you need emergency care? So there's so many things that impact the future of our healthcare and the future of your ability to make decisions for yourself. So I urge people to just get educated. Go to FloridiansProtectingFreedom.com. You'll also see that Planned Parenthood of Southeast and North Florida has a lot of different advertisements up where we're just trying to expose the patient impact Because really at the end of the day, people ask me all the time, well, how are you all doing operations? It doesn't matter. Like, we're focused on our patients. The impact on our patients is the real story. Like, this is what they're going through. Like, we'll figure it out. We've been offering reproductive health care for over 50 years in Florida. We do STI testing, we do contraception. And I try to tell people more than 90% of what we do is preventative care. But abortion is so important, and it's so important for Floridians to have access to this care. So just get educated, get involved any way you can. Thank you both so much for being a part of this conversation. It is so important. And if you all want to learn more about what we're doing, our services, check us out on our social media platforms. We're not just about care. We want to connect with you as well. So just check us out on Instagram, TikTok, Facebook. We're on every platform at PPSCNFL. Thank you all so much, and have a great rest of your day.